All right, 5 minutes after 11 o'clock, nice looking Wednesday. Dr. Riadh Fakhoury is in the studio. If you have a question about your health, this is a good time to call. The number is the WOCA Climate Control Source Hotline, 622-9622. I almost forgot the phone number there. The show is called the Head to Toe Care Show, and Dr. Riadh Fakhoury, of course, is a chiropractic orthopedist and the owner of Fakhoury Medical and Chiropractic Center. And we'll give you his address and phone number later on. Right now, if you want to call the show, though, the show is live on April 17th, and Dr. Fakhoury is right here, right now. Good morning, Doctor.
Good morning, Larry. Here we go now. 622-9622.
Did I say it wrong?
No, you said it right.
Okay, I said it too fast, right?
Oh, you did great, though.
622. I know. I got to calm down. Slow down.
622-9622. We've had some great questions coming in the last couple of shows. So,
yeah.
So some interesting questions, and if anybody has any questions that they have on their physical complaints or maybe some type of process that might be going on with their body, maybe they're having some health issues or concerns, bring those out, because I can always guarantee that if you're asking a question, there's many other people that are quietly listening that would like to get some information on that. And if we can answer it, we will. If it's something that takes some research, we'll bring it back on the next show and talk about it then. So happy to field any questions. And as you say, Larry, it doesn't always have to be with something, a topic that we're talking about. We may be talking about the neck, and somebody wants to know why their first three fingers, their thumb and their two fingers, go numb. And we want to be able to talk about that and answer those questions, because the body's complex and people start getting nervous and worried, and if they don't know why their body's doing something, or they're starting to notice parts of their bodies that they didn't have before, or why they might be having cramping in muscles or weakness in the legs or arms, those are things that we want to be able to answer, because the knowledge helps them to know how to proceed with it, and lets them also know what the problem is too. So it's relaxing when you have a good idea of what's causing your problems.
I'm going to combine the two. I sort of kind of hinted at something before we went on the air, but 2 days ago we had an anesthesiologist on the air, and he was talking about a procedure where they actually put electricity into your spine. Spinal cord, did I say it wrong?
It's called a spinal cord stimulator.
Okay. And the reason you would do that is because there's pain that's never ever going to go away. So instead of making the cause go away, they just stop the I guess the transmission, for lack of a better way to ask this question.
Right.
In other words, my foot is hurt. It's never going to not hurt. So rather than fixing the foot, I'm going to stop the pain from getting to the brain.
Correct.
Is there a better way to do that, or are you okay with that way?
I'm okay with that. In fact, at the Fakhoury Medical and Chiropractic Center, in our interventional medicine department, we do spinal cord stimulator trials, which is the test to see if it helps the patients for 2 to 4 days. And before you implant it, you want to try it first and see if it's effective before you go through the process of implant. So the anesthesiologist will do the implant, the surgeon will do the implant, but we do some testing prior to that to make sure that it is a viable form of treatment to help block the pain. And that's what it does. A spinal cord stimulator is like a TENS unit. If some of the listeners know what a TENS unit, we put it on the outside with 4 patches on the skin, and it sends a vibration. And that vibration current travels to the brain faster than the pain message. So they use 2 different tracks. One is a freeway and the one is a back road.
Really?
So the pain message is a back road. It's slower. It takes more time to get to the brain. Where the vibratory sense is a faster message. And really we're built that way to protect us, because if our stomach hurts, that's deep inside. That's a different type of pain than if something is crawling on you that might bite you and could kill you. So that sense of soft touch or vibratory touch gets to our brain faster as a protective mechanism. So when we use the TENS unit, we put 4 patches around the pain and turn it on. The vibration gets to the brain faster than the pain message does, and the brain can only perceive one of those 2 at the same time.
Oh wow!
So it feels the vibration and does not feel the pain. So it's not eliminating the pain, but it's blocking the pain.
The explanation you just gave actually answers the next question. So, but let me just ask it, because I was misunderstanding the whole process. I kind of compared it to cutting the wire, like of a lamp. Let's say the bulb is flickering, and rather than dealing with the flicker, I'm just going to cut the lamp. The only problem is the line I'm cutting is an extension cord, and it also works the toaster. So now I no longer can work the toaster either. So I was thinking that if I had a pain in my foot and the stimulator stopped the pain, then I also would be numb in my foot.
Not necessarily. Again,
Wow.
it's, for example, let's say you have a dim light, and if you bring a brighter light close to it, you no longer see the dim light because the brighter light overshadows
I like that, yeah.
and covers up the dimmer light, and that's sort of the idea. Let's say you've had an incandescent bulb in your room, and let's say it's 15 watts, and then you turn a fluorescent light overhead. You no longer see the incandescent bulb because the fluorescent light overpowers it. And so the TENS unit, which is the transcutaneous electrical stimulation, is what it stands for, is a system that we use in the office by giving people a TENS unit that have chronic pain. These are the people that you've done the chiropractic, the massage, the rehab, injection therapy, surgery maybe, and it's all failed and they continue having problems. So now you can't really recover with the pain, but you block the pain so they have a level of comfort to improve their quality of living. And so the TENS unit is the most basic. It's an external unit with wires that you can circle the pain, turn it on. It stimulates the posterior fibers of the spinal cord, which get the message up to the brain faster than the pain message, blocking the pain message. What is a spinal cord stimulator? The same concept, more complex, but the same concept of putting a lead in the spinal cord close to the posterior column.
Wow.
And when the machine is turned on, and it's a very sophisticated equipment, when it's turned on, it produces that vibratory sensation that's picked up by that part of the spinal cord to shoot the pain, the message of vibration up to the brain faster than the pain. So the patient will feel that vibration sensation, which is a more comfortable sensation to feel than pain. It doesn't eliminate the pain, but it blocks the pain.
Wow, wow! You explained it in such a way that I think I get it. And the other question was, a non-chiropractic type of pain could actually be helped with that, right?
Yes. I think you want to take it after the
call? You do have a phone call?
Okay, great.
Good morning. You're on there with Dr. Fakhoury.
Yes, good morning, Dr. Fakhoury.
Hey, good morning.
See, speaking of the spinal cord, a person that's had surgery and has had some areas fused, can you treat a person? Can you that had that situation done to them? Treat them?
Treat them with chiropractic or
treat? Yes.
That's a good question. In that the answer is almost always yes.
Really?
So some people will say, "Oh, I've had surgery. I can't get chiropractic care any further."
Yeah.
However, we have so many patients coming in that have had fusions, discectomies, laminectomies, and we could still take care of them. We just have to modify the way that we treat them and make some adjustments in the care that we supply them. They can still get the conservative rehab care quite often. They can still get conservative massage care. And as far as with the chiropractic care, we modify it. We may need the activator. We may need blocks. We may need the Cox manual distraction table.
Okay.
But to answer your question, even if people have had surgery, more often than not, we can help them and give them some relief, especially if it's what we call a post-surgical failure, where they've had surgery but it hasn't really helped with the pain.
Yeah.
The surgeon might have removed the pressure off the nerve and taken the disc material off of the nerve and helped that way, which is really what the essence of the surgery is to remove the disc off of the nerve. Sometimes it does relieve with the pain, sometimes not. But what we do and highly recommend after somebody's had a surgery is come back in, get evaluated, and look at their bodies from a mechanical point of view, because when the surgery is done, if there's a fusion, the area above the fusion is going to sometimes get unstable and wear out faster than it should, because it's making up for its normal motion plus the motion that's been the area that's been fused. And that excess motion of that area will cause some degeneration or arthritis. So what we try to do is help that area, so that way we distribute the stress from that fusion over other areas of the spine instead of specifically above or below that surgery.
Yeah, my sister had a hip replacement, and this is going back a few years back, and she still has discomfort. Is there anything that your practice could do to help relieve pain with a replacement situation?
Possibly, yes, because at times maybe it's a leg length discrepancy and we have to put a heel lift in there. Sometimes it's just, we've spoken about muscles and how when they get tight and spasmed, they may stay that way for years.
Yeah.
And we have to help them and balance the musculatures so the right and the left are equal.
Yeah.
Sometimes an individual will have a hip replacement, and when I'm checking the balance of the quadricep muscles in the front of the thigh, there's a big discrepancy. One is very tight and spasmed, the other is weak. So we balance that out, and we do that through our massage therapy.
Yeah.
And we also do that with stretches and the rehab program. And other times the hip pain may be related to the back. So if that's the case, we do the adjustments on the low back, the sacroiliac joint, and improve the function of the pelvis and the hip, which will take some of the stress off of that.
Yeah. Would it be possible for a person to have somewhat of a treatment before they go in for a hip replacement that would make it an easier situation?
That's another great question. We do have patients that come in and say, I'm scheduled for the 20th of April, and they want to be aligned, they want to be balanced, and they want everything equal on both sides, the sacroiliac joint moving freely, because they know that from the stress and the limping and laying in bed a little bit more than usual, that may cause secondary back problems. So they come in actually preventively, or what we call prophylactically, to treat their spine, to make sure that they're balanced when they're going in for surgery. They're at optimum condition.
Okay. Thank you very much for your answer.
Thank you for those questions.
Bye now.
Bye-bye.
Does that actually make it easier for the surgeon? Is the surgeon's job easier if they've been adjusted?
I'm not sure if that will make a difference for the surgeon. I know that if the pelvis is lined up, then their leg length discrepancy will be less, so that way the surgeon will get a more accurate reading of what the leg length should be. So I think secondarily that's a benefit. But further than that, I'm not sure. But I know from the patient's point of view, the patient is usually much more comfortable and a stronger recovery, most likely because of the fact that they're not dealing with back pain, sacroiliac pain. Especially if they're predisposed to have back pain, sciatica, it's a good idea to get a couple adjustments before that procedure to make sure that they won't have a flare-up, which will make it difficulty to have the recovery of therapy post-surgery.
I think the knowledge that you can help somebody live without pain is awesome. Just the fact that somebody listening right now who's going through pain, or maybe knows somebody, will be able to say, hey, go see Dr. Fakhoury. There's probably a way that you don't have to live with this. You've been living with it for years sometimes, right? And you hear that, don't you?
I do, and it's really... It's a bit frustrating because people suffer and sometimes they don't need to. And when they finally come into the office and they get treated, a perfect example is a young boy, just as we mentioned it before, 12, 13 years old, 2 years he's had headaches and neck pain and shoulder pain. It was a post-trauma. And he suffered for 2 years that he didn't need to, because one adjustment and we called mom and the headaches were gone. And so,
isn't that amazing?
Yeah, it really is, and it just makes you feel good to help somebody, but you want to help people faster so they don't have to suffer needlessly. And we can't help everybody, but the majority of the people coming into the office, we can help them within the conservative management of chiropractic, rehab, massage, our multidisciplinary approach of having a mixture of medical, chiropractic, rehab, massage to be able to help that individual.
Is the thing that causes pain the same or similar to the thing that causes numbness?
Pain is very complex, and as you know, it's individual to that person, that specific person. But there are different parts of the nerve, and one part of the nerve will cause a burning sensation, another one will give you more of a numbness, another one will give you a sharp shooting pain. So it depends on what portion of the nerve is being irritated, and we actually use that in our history to help us to determine what this patient is suffering with. For example, numbness is worse than sharp shooting pain. Even though sharp shooting pain might be more uncomfortable, I'd rather see that in a patient coming in than, hey, I can't feel my hand, I can't feel my finger, I burn myself and I can't feel it, I can put a needle in my finger and I won't feel it, or my foot, I won't feel it. Just last week somebody told me that, and that means that there's a direct pressure and an extreme pressure on the nerve that's affecting its ability to function properly, and that's not healthy, because the numbness is usually associated with weakness, and weakness sometimes left undetected and untreated will result in permanent damage to that nerve. So if somebody is walking and their knee gives out on them and just buckles for no specific reason, and they, their knee just gives out, or if they're trying to pick something up and they feel they just can't pick it up like they could before, or if they're hammering and their arm gets tired where it didn't before, those are the symptomatologies of weakness that need to be addressed and looked at immediately. There's a nice lady, a very hard-working lady that came in last week. She works with her husband in a lawn service, and she's noticing that her leg is giving out on her. She's getting weaker, so we did some testing and noticed for sure that she is having weakness on the right side. She's not having any pain, but she's having weakness in the right leg, so we're ordering a repeat MRI on her and doing an EMG study to see if the nerves have been damaged and what nerves are involved, and moving her forward towards possible surgical intervention if that weakness continues.
We were talking about a report yesterday, and I might get the numbers wrong here. It was either 1 pound or 10 pounds. But the report said that, I'll just use 1 pound, and remember, I might be wrong, it might be 10. But for every 1 pound we are overweight, there's another 7 miles of blood vessels that the body has to create to bring blood to that new part of your body. And circulation obviously becomes an issue as you gain weight. If every 10 miles of 10 pounds is 70 miles of,
it's incredible, isn't it?
Yeah.
Just to think about that, and it's an additional stress on the heart, and more blood vessels, more tracking that the blood has to go through. So and not only that, but the extra weight loads the spine, loads our joints, more pressure on the knee, the hip, the back, and then that can cause some secondary problems also.
When somebody has a massage and it stimulates the circulation of the blood, does it also stimulate the other fluids that circulate, like lymph and all that?
It does, and lymph is a clear fluid that is basically there to help you with your immune system and with your ability to fight things off, and it parallels and runs with the blood vessels and goes through your whole entire body. And when you're getting a massage, the massage therapists that we had at the Fakhoury Medical and Chiropractic Center are trained in lymphatic drainage to be able to not only relax the muscle, not only improve the circulation through your system, these are the benefits of the massage therapy, but also to address your lymphatic drainage and allow it to circulate better. And we have amazing massage therapists that are trained in all aspects, in sports injury, in trauma injury, in pregnancy, in elderly care, so that way they all have their specialty to be able to maximize the massage, so you get more than just a feel-good massage. It's more of a medical massage.
So the heart circulates the blood. What circulates the lymph?
Great question. The pulsating of the vascular system of the blood vessels. Since you have your lymphatic vessels close to the blood vessels, the pulsating of the blood vessels helps push on the lymphatic system and helps it to move along.
Amazing,
since
isn't
it's a passive system. What else helps to move the lymphatic is movement and activity. If you are dormant and just sit, your legs will swell. It's because the lymph will settle in your ankles. But when you walk and you move and your muscles contract, then the muscular contraction pushes the lymphatic fluid through the system and to the lymphatic duct, and then that circulates again. So lymphatic movement is a passive movement, and it's assisted by motion of the individual, muscular contraction, and also the pulsating of the blood vessels which are close to it.
So I'm just going out on a limb here. If you're stagnant, if you're sedentary like I am, and you start to have
did you say you're going out on a lymph?
Oh, yeah. Oh, good. That was good. And you've got the gathering of fluid at your feet, let's say.
Yes.
Does that actually cause pain?
It can, because the fluid stretches the tissues, can put pressure on the tendons, can cause secondary pain. We see that lymph build up in people's arms if they've had, for example, a breast surgery to be able to remove maybe a cancer, and they find that they have to remove some lymph nodes, and when the lymph nodes are removed, you've disrupted the proper drainage of the lymph out of the arm, hence the lymph can't get out of the arm as easily as it goes in, so you get the swelling. And what most people will do is wear a tight support brace, elastic band on the forearm and up into the bicep to help push the fluid up and out.
Wow. And does the fluid, if it's gathered in one place and then suddenly pushed back where it should be, does it create like a rush of fluid, and does that cause problems?
Not necessarily. No? There's elasticity and movement to the system. Better that it moves and gets out of there, because if fluid stays stagnant, it's not healthy. It stretches the tissue gets thinner, and then there could be secondary problems, cellulitis and secondary problems with it also. So movement is good, activity is good. Touching a little bit on your question that you were saying about those people that may not, and similar to the question that came in, let's say that somebody has back surgery, can we treat them? Somebody has a hip replacement, can we treat them? And you were asking, before we talked before the show a little bit about somebody who has a disease disorder that cannot be helped by chiropractic or limited by chiropractic. Can we still help that individual? Similar to the question about if somebody has a hip replacement or back surgery, can you help them? More often than not, yes, we can. For example, if somebody has cancer or some other underlying disease process, the treatment is not going to eliminate that disease process. It's not going to cure the cancer. It's not going to get rid of it. Just like with arthritis, we don't remove the arthritis. We don't get rid of it. But we help that person through gentle mobilization and through balancing the body, getting joints to start moving again and get lubricated. We help that patient feel better. So in the case that somebody has a disease, we're not going to eliminate that disease, but we're going to help them to feel better while they're getting over that disease process. And that's important too, Larry, because if somebody's dealing with pain, you've had it before, it distracts you from your work, it distracts you, it drains you, it tires you out.
Even a headache.
Yeah, it really does. And so what it does, that reduces your ability to fight off the disease process. So if your body is being split in its energies between the disease process and healing from that, and pain, having to deal with that, it weakens that individual's ability to be able to fight the disease process. So if we're taking that load off of the body, they feel better, they function better, they have more energy. That allows them to do better at fighting the disease process, whatever it might be. It could be a cold, it could be a flu.
Makes sense, doesn't it?
It could be cancer, it could be whatever the scenario. So we have many patients coming at the Fakhoury Medical and Chiropractic Center, and with our multidisciplinary approach for neck and back problems, helping them to feel better, which just helps them overall in their general day-to-day activities.
So what do you do when you are hurting? Do you go to one of your doctors?
You better believe it. Yes. In fact, I try to go, again, we use the word prophylactively, preventively. I'd like to get adjusted twice a month just to make sure that all joints are working properly, there's no pressure on the nerve, because remember, in our rush lives, sometimes we could have something happening and not notice it. And it comes to our realization when the pain is so great, or it starts interfering with our activity. But why not take care of it early on before we really notice it? So what will happen is Dr. Hutchison or Dr. Teeter will palpate. If something's out of alignment, gently bring it back into alignment by different methods, and then that area will function better.
So if it's discomfort, which I guess is the low end of pain, or if it's actual pain, that's the high end of pain, call Dr. Fakhoury. I love when I hear from listeners who say, and you've had them call on the show, that they were in pain. It took 2 years before they finally went to see a doctor, and you were able to fix it within a few sessions.
And it is good if you notice any part of your body, then that's a dysfunction. Something is not right. You shouldn't feel your eyeballs, you shouldn't feel your ears, you shouldn't feel your toes. If you're noticing that, then that's something that needs to be addressed.
Oh wow, that's a good rule of thumb.
Let's look at it, let's find out if it's something that we can address and take care of, let's do it. And if it's something that needs to be taken care of outside of our office, like with the primary care physician or a specialist, we'll make sure to get that person to that specialist or the primary care immediately for follow-up. For example, somebody may have a forward curvature of their mid-back, which is called a kyphosis, or they're slumped forward. It may be that they had a compression fracture. At that point, Dr. Shanawani will evaluate, We'll order the CAT scan or MRI, diagnose it, refer that on to a specialist like the anesthesiologist, who does the kyphoplasty and rebuild that vertebrae to a square again, so that way you get rid of that wedging.
And I know we're done, but real quick question about the TENS unit or about the spinal stimulation.
Yes.
Is that battery powered? Do you have a battery with you at all times?
Yes, you do.
Yeah.
On the external system, it is a battery, 9-volt battery. On the one that's within the body, the internal one, it is battery that you could recharge every night.
Can I squeeze in one? I know it's the tail end.
Yeah, let's do it.
Yeah,
no,
squeeze in the tail end one. Okay. Good morning. You're on the air with Dr. Fakhoury.
Yes, I have a friend who has, she was born with club feet and no one ever took care of it. She's now in her 60s. She's in a lot of pain, but all she has is Medicare. Is she able to come to your office?
Yes, she is, of course. She's more than welcome to come in. We'll evaluate to see what we can do to help out. We had one lady, and it's sort of genetic because it's in her brother and other family members, her mother, that was having terrific pain in the feet, and some light mobilization of the feet alleviated all of the pain in her foot. And she said, I want you to do the same thing to my brother, who was a patient but neglected to complain about his feet because he didn't know to ask. Did the same treatment for the brother, took all the pain away also. So it might be a very simple type of mobilization, because it could be just an arthritic change that's happening in the feet. It might be an inflammatory process. So I would recommend that have them contact the office. Let's evaluate. It's so much easier when we see that patient and find out what is causing the pain. Is it poor mechanics? Is it an arch problem? Is it an inflammatory problem? Or is it you have a lot of bones in those feet? Are some of the bones out of alignment causing the pain?
Okay, because her feet are almost flat at this point, and her ankle is over to the side, and it's just getting worse. The pain is.
Right, and she's still young, and that will affect her vitality. So in the bigger picture, that can have a dramatic effect on her health. So seeing her, we would start with some gentle support of the flat-footedness and help to bring the arch in, which will help alleviate the poor mechanics and improve the function of the foot. So that in itself will probably help quite a bit of the pain that she might be experiencing also.
Okay, so she just needs to call over and make an appointment?
I would say so, because she sounds like she's having more of a complex scenario, and we have to take a look to see exactly what the best approach would be for her. So have her feel free, and I know we'll say the number shortly. Just have her call, ask for me personally. We'll be happy to take a look at her. And my background is as a chiropractic physician. I also trained under a podiatrist. He had a dual degree of podiatry and chiropractic, so I was blessed with his knowledge and being able to properly evaluate the feet and know how to take care of those types of situations.
Okay, thank you. That sounds great.
Okay, thank you very much.
Really.
Thanks for the question.
That was good news, I think, for her and her friend. Yes, let's give out the phone number. What is your phone number?
The office number is 351-3413, and if you contact that, option 4 will take you directly to the front desk, or our patient care coordinator to be able to help answer any questions that you might have, and to schedule an appointment if you'd like to visit with a doctor personally.
Okay, and your address?
The address, we're on 17th Street at 1009 Southwest 16th Lane, which is right off of 17th Street as you pass over 441 towards 200, bottom of the bridge. On the right-hand side, you just make a right at that light. That takes you directly to our office. And something that people don't realize, Larry, is we're there on Saturdays also. We have Monday through Saturday fully staffed with chiropractic physicians.
That is good to know. Yeah, sometimes Saturday's the only day we have, right?
It is in our busy lives.
And then you don't have it because you're coming in for us. So.
It's a good thing.
Thank you, Doctor. Always good to have a little bit more information.
Thank you very much, Larry. Appreciate it.
If you missed any of the phone numbers or addresses and you would like them repeated, and you can call us, we'll be glad to repeat them for you over the phone, or you can go to the WOCA website, look at the AMOCal Live guest list. You'll see Dr. Fakhoury's name at the 11 o'clock slot every Wednesday, and the phone number and address are right there. Thank you, Doctor.
Thank you, Larry.
We'll take a little break and be right back.
Accident, injured, hurting? Pain affects so many of us and keeps us from enjoying our daily routine. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Let me visit with you to answer your questions. Let us help you help yourself on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA. Again, that's Dr. Riadh Fakhoury, here to help you.